Hi there, Dr. Roger Sohn. I'm here to give you some shoulder tips. A question I get asked frequently is, how should I sleep? I'm a side sleeper. It hurts to sleep on my side. Sleeping on your side can definitely increase your shoulder pain, especially if you like to sleep on the side that hurts. It can be a lot harder than just saying, okay, I'm going to sleep on my back, however, so I'm going to give you some tips about how you can reduce your shoulder pain when sleeping on your side. When you sleep on your side, the part of your shoulder that actually contacts the bed and it receives the most pressure is going to be the outside of your shoulder, and it's really going to be just the humerus, the actual greater tuberosity, and the lateral side of the humerus that's going to be exerting pressure from the bed, the mattress, and through your joint and through the joint itself. So if you have something like arthritis, or if you have a rotator cuff tear, or if you have pathology of the biceps tendon, all of these can hurt. In fact, it can hurt to sleep on the opposite shoulder sometimes because the force is transmitted from the opposite side and gravity pulling and compressing your shoulders together. This can also increase the force on your shoulder, increasing your shoulder pain. So here are some simple tips that can help you reduce your shoulder pain. Tip number 1. If you must sleep on your side, try sleeping not completely at a fully lateral position, but slightly rolled to one side. By that I mean that the flat of your shoulder blade is not directly flat against your rib cage. It's actually each of the shoulder blades rotates slightly forward. So by the same token, when you're sleeping on your side, rather than sleeping directly on the most prominent part of your shoulder, you can reduce the pressure by simply rolling, and that allows the shoulder blade to share some of that pressure, and that can reduce the pain that you experience. Number 2. Get yourself a pillow, and don't put the pillow here like you might think on the side of your head, but rather the pillow should go right here. And it shouldn't be contacting any portion of this shoulder. It should actually be just right here on your rib cage. By elevating this portion of my rib cage with the pillow, it actually reduces the amount of pressure that my shoulder is feeling. So it may be best to use like a rolled up towel or slightly folded up bath towel, or maybe a camping pillow, something small, not the size of the pillow that you would put under your neck or your head, but something small. And like I said, you can start with something that you already have, like a towel, and fold it up and experiment with different thicknesses to see if we can actually get the sweet spot where you're sharing the load with your rib cage as well with the shoulder. And lastly, if your pain continues, let's say it's been 6 months or even a year, you may want to go see a doctor, someone who specializes in the shoulder that can help diagnose and potentially treat your problem. Because other than just having shoulder pain, when your shoulder pain interrupts your sleep, it can affect a lot of your life, and it can affect your ability to concentrate, your ability to enjoy your life. And therefore, if it's something that is within reach, you may consider having it fixed for once and for all rather than just placing band-aids on it. Alright, thanks again for watching. I hope this was helpful. Please let me know if you have any other questions in the comments below. If you also have any other topics you'd like me to cover, please let me know in the comments section. Thank you very much.